I'm talking about breast cancer reconstruction following mastectomy. I'm Dr. Demestri, board certified plastic surgeon practicing in Austin, Texas. So basically, once you have your mastectomy removed, often patients will either get tissue expanders, that's a deflated implant that can be stretched out if they ultimately want to be bigger, or a direct to implant reconstruction. So the question is, can your expanders or implants get infected during radiation? And if so, can you have radiation first and then put in the expander or implant to avoid this risk factor? So to the first question, can your expanders get infected during radiation? Absolutely. Infection is actually a pretty big risk when you are getting an immediate implant-based reconstruction following mastectomy. And the reason for that is that you're losing the main source of blood flow to your overlying skin, which is through the breast gland that's being removed. So now you just have blood flow through the sides. So that combined with adding a foreign object and you don't have good circulation to clear the bugs can live on the surface of the foreign object, there is quite a high risk of infection. Now, with that known, and then radiation puts a whole other stress onto that. So radiation causes changes again in the blood flow, in the elasticity of the skin, and in its ability to defend itself against infection and bacteria. So can you have radiation first and then expanders? So radiation actually complicates implant reconstruction a lot. So the preference is still, if you're going to have radiation, to put in the expander or the implant at the same time as the mastectomy while your skin still has all of that stretch. Then you get the radiation, and there are some known things that happen. So for sure, you're going to get some degree of capsular contracture, which is a thickening of the scar tissue around the envelope. Sometimes this can actually be quite mild, especially with certain things to counteract it. Once you're all healed up, I have my patients do deep massage, there's medications, and sometimes it ends up being acceptable. Sometimes that radiation change can be quite significant. It can get really hard and encapsulated, and either you'll need, in the simplest form, to just release that with another surgery or to bring in tissue from elsewhere. So back, belly, bringing in healthy non-radiated tissue. Now the problem if you have your mastectomy, no reconstruction, and then you have radiation is it causes, the radiation causes permanent thickening and inelasticity to that skin. So after someone has been radiated, I don't put in expanders anymore. So that means then you'd go in underneath that tight skin, put the expander, and try to stretch it. But the problem is that skin is so non-stretchy that it doesn't work well, and it does still set you up for risk of infection, extrusion implant exposure. So if people have come to see me after they've had their mastectomy and radiation, I don't personally offer implant reconstruction alone. I'll be talking to you about either doing a fully natural tissue reconstruction, like using your belly, or doing a hybrid reconstruction where we use part of your own healthy skin and also an implant. Unfortunately, reconstruction is just fraught with complications. Luckily, as surgeons, we see them, we know how to deal with them, we can work through you with them to get you through them, and then there's things technically that we do to minimize. I mean, we wash with huge amounts of antibiotic solutions, can put in antibiotic spacers underneath the expanders that tend to help a lot with that, give you prophylactic preventative antibiotics, but even with all of that, complications arise.